A nonprofit pharmaceutical may sound like a contradiction in terms, but a Bay Area woman is proving that it can be done. OneWorld Health in San Francisco has begun to have a worldwide impact. It's the brainchild of Victoria Hale. And Carolyn Johnson has tonight's ABC 7 salute.
She has a high fever.
Victoria Hale has traveled to India 4 times and seen firsthand the devastation caused by disease and poverty.
Once you see it, you can't get it out of your mind. That we have a drug that's sitting in Geneva, the World Health Organization. We have people who are incredibly poor, and there's just no one to finish up the job. Until you came along. That's right.
5 years ago, Hale created the Institute for OneWorld Health, a nonprofit drug company with the goal of treating neglected diseases affecting the poorest of the poor. As a pharmacologist who'd worked for the FDA and in biotech, she knew drugs existed that could make a huge difference in third world countries.
Why can't we take those discoveries that aren't moving forward in a nonprofit model and put the pieces together and get them out there to the people who need them?
And I told her to go ahead and do it. It'll work. And she's the right person to do it.
Hale worked with Professor Les Bennett as a graduate student at UCSF.
She's going to have a big impact on global health.
Her company's first drug, paramomycin, an antibiotic developed in the 1950s. The rights to it had since been given to the World Health Organization, and Victoria Hale saw a golden opportunity.
We start late in the process. We build upon the work of others and then finish up the job. We find products as late in the process as we can and match them to a need, knowing that there's someone in the end who wants to do something with this.
The drug had shown great promise in treating visceral leishmaniasis, or black fever. The disease is spread by sandflies and affects more than 1.5 million people worldwide, mainly on the Indian subcontinent. Without treatment, it is fatal. With the help of the Indian government and scientists there, clinical trials of paramomycin are now complete. It has a 94% cure rate for black fever at a fraction of the cost, less than $10 for a full course of treatment. And for OneWorld Health, it is just the beginning. Right now, the nonprofit drug company is partnering with researchers at UC Berkeley and Amyris Biotechnologies to create a more affordable, accessible cure for malaria. The Bill and Melinda Gates Foundation gave OneWorld Health a grant of more than $42 million to make it happen. For Victoria Hale, her dream of easing suffering and saving lives worldwide is coming true.
We're in the 21st century, and we have medicines that are exquisite and elegant and evolving every day. So how can we live on one planet and have those two situations, so those two health situations be concurrent? I couldn't.
And so we salute Victoria Hale for having the vision to create the nation's first nonprofit drug company. We have a link to OneWorld Health, the website. Just go to abc7news.com and look on the quick links menu for ABC7 Salutes. Extraordinary story.
Very impressive. All right, let's check in with Spencer.